So the World Health Organization is warning that Africa could become the next epicenter of the coronavirus outbreak. So far, there have been fewer than 1,000 deaths from COVID-19 across the continent, which is a much lower rate than in the US and in Europe. The United Nations says it's likely the pandemic will kill at least 300,000 people on the continent and push nearly 30 million into poverty. UN Secretary-General Antonio Guterres has said Africa needs more than $200 billion to combat the virus. And the WHO fears the death toll could already be far higher.
In the past week, there has been a 51% increase in the number of reported cases in my own continent, Africa, and a 60% increase in the number of reported deaths. With the current challenge of obtaining testing kits, it's likely that the real numbers are higher than reported.
Let's speak now to Rossi Hassad, who is an epidemiologist and professor at Mercy College, joins us on Skype from New York. Welcome to the programme, sir. This warning from the WHO about numbers being much higher. I mean, at the moment, we're talking about 20,000 cases across the continent and less than 1,000 deaths, which it all sounds very low at the moment, doesn't it?
So indeed, the UN estimate of 300,000 cases paints a very grim picture of what we can expect to see in the coming months, almost a doomsday picture. And while I'm inclined to say it can prove another gross overestimation, this exaggeration seems to be more plausible, given that we know that this virus is highly transmissible and highly lethal. And the perfect set of factors for susceptibility and spread exists in most of the African countries. So any foothold of this virus in any country is likely to be met with an explosion of this spread.
And what are those factors that you're talking about?
Well, primarily a weak healthcare infrastructure. And we like to say also the perfect enemy of public health is a crowd. And when you think of most African countries, they are characterized by overcrowding, especially in the urban areas. But adding to that, as well as the poor healthcare infrastructure, are factors that can lead to serious illness and death. For example, endemic all year round in most of those countries are diseases such as tuberculosis, HIV/AIDS, and malnutrition. And those conditions tend to lead to compromised immune systems and therefore can fuel and lead the epidemic and lead to serious disease and death. So it's the perfect recipe to drive an epidemic and lead to explosion. So I can understand the concern of the UN here.
Right, so 300 deaths could be a very real number. What can be done? What can the world do to try and mitigate this?
In the absence of a vaccine and any specific treatment, when it comes to infectious diseases, throughout the centuries, it has been behavioral interventions, as we are seeing now. And it's troubling because even in the developed countries, it's a challenge. You can imagine in countries that have much less resources. So to answer your question directly, we need to continue to focus on the behavioral interventions, social distancing in particular. How feasible is social distancing in some parts of Africa is questionable, given the overcrowding and in some of the slum areas of Africa. So this is going to prove a huge challenge.
Rossi Hassad, great to get your perspective on this. Do appreciate it. Very important. Thanks very much indeed. Rossi Hassad there from Mercy College in New York.
Thank you.